Hey folks, most recently I put out a video concerning the Evusheld, which is basically a prophylactic / preventative type injection that's been given to many of us who are immunosuppressed or immunocompromised. After putting out that video and realizing that based upon the fact that it's 25 minutes long, many of you are not really going to be able to watch that video down to the real point, the real root of the video, which basically is I was going through that entire video, kind of checking out their own website, their own information, their own points, basically trying to prove that we ought to take the vaccine. What I really stumbled across toward the end of that is that there are actually some pretty strong cardiological warnings that are being given to those who are candidates for that particular vaccine. So based upon that and knowing it is 25 minutes long, you may never get down to that, I decided just to take that little clip, that little snippet, and put it in a video format here, which would be much shorter to make sure that you, if you're a cardiology patient, a heart transplant recipient like myself, or whatever, if you've had any past issues with cardiological type of problems, you really need to watch this part of the video because it's really where they go ahead and admit the caution that needs to be taken before taking those vaccines. Anyway, just a snippet just to get you through it quickly, but until I see you again, stay stronger, friends. I'm a heart transplant patient. You are, many of you as well. My concern comes right here. They have a whole section dedicated to cardiac heart events, okay? A whole section dedicated to that. And let me read you a little bit about what it says. It says, in the clinical trial for Evusheld, more people with cardiac risk, and it brackets, including a history of heart attack, experienced serious cardiac events than those who did not receive Evusheld. It is not known if these events are related to Evusheld or to the underlying medical conditions. And it says contact your healthcare provider, basically to talk this over. Okay. Now, again, I think they're being open and honest with this, and I'm thankful. But they say directly here on their website, they dedicate, and you scroll on, there's more to read, not much more to read. There's not much more to read, but you can scroll on and you can find out. They give you a little bit more information, but it is intriguing to me that they give a whole section here directly to nothing but cardiac heart events. And they say up front, if you have a history of a heart condition, I qualify, heart transplant patient, myocarditis, pericarditis, you name it, I've had it. Right now I have an aortic valve that's been replaced. I'm still dealing with a little bit of a heart, we're heart patients. If you have a history of that, they have seen, okay, they can't explain, but they have seen an increase in cardiac events among those who have had a cardiac history and taken Evusheld. So basically they're telling us, if you get this vaccine, they'll put it right in one of your arms, maybe this one. I like this one because I'm left-handed, but they'll put it right here in your arm in that muscle tissue. If you take this vaccine, they're telling you on their website, if you are have cardiac risk factors or a history of a heart attack or any cardiac type stuff, you could assume, they know that they have seen people who've experienced, quote, experienced serious cardiac events, more so than those who did not take Evusheld. So what would I do if I were in my shoes and yours? I recommend to you the things that I do. I would say, one, I probably wouldn't run out to the doctor and ask them, can you give me the Evusheld? I probably wouldn't do that. You may choose to, that's fine. Two, if I did go to my transplant team or any doctor for that matter, and they set me down and say, I noticed that you're immunosuppressed and that we've got this trial going on with Evusheld, and I noticed that you might qualify for that. Would you like to get that vaccine today? Stop. You may not refuse it. You'll make that choice, but stop right there and explain to them, if they're not already aware of it. Your team hopefully would be, but if they're not aware of it, stop right there and say, look, I've studied up on this. I didn't look at a third party opinion on this. Yeah, I saw the transplant helper's video, but all he did was show me to go to the Evusheld.com website, and we scrolled together through that page, and I saw specifically, one, this is not for everybody. Two, It may not help as much as it hurts, although there's a low risk of anything adverse happening. But 3, in my case, I am a cardiac patient, okay? I am a cardiac patient. I take cardiac medications. I deal with cardiac issues on a regular basis. They told me on their website, not that great of an idea. Just not a great idea, okay? It could increase, and they're even saying, experience, quote, serious cardiac events more than those who did not receive it. So why do I want to increase my potential for a, quote, serious cardiac event? I don't. So to answer the question from way back, have you taken Evusheld? No. Do you plan to, Jim? At this point, absolutely no, I don't. Do I think that that's a blanket statement that applies to everyone? No. No, I don't. No, I do not. You've got to make your own choice, and I pray that you've got a team that is willing to help you in making your own choice. But just be aware of the facts. This is a prophylactic preventative medication. It is not to be taken if you currently have COVID. It doesn't cure COVID, okay? It doesn't even improve it. It's to be taken as a preventative when you're not sick. Be aware it may not be as effective as you hope. But that's a part of a trial, right? Be aware it may have some risk that you're not aware of. That's a part of a trial, right? But for me as a cardiac patient, they admit it will increase the risk. They can't directly tie that, but they admit they've seen it. They admit it is a fact. And so for that, I'm out. I'm out. Like on Shark Tank, I'm out. For that reason, I'm out. And you have to make your choice. But thank you so much for joining me today. I know this has been lengthy. And hey, I'll admit right here at the end of the video, if you would have went to the Evusheld website, you would have read what I read. But I think it's good sometimes to sit down and talk about this. I would like to know in the comments. I'm not arguing with you. I'm not looking for anyone to argue with each other. So in the comments, you know, keep it nice, keep it clean. But have you taken Evusheld? I'm going to expect already you haven't had any adverse effects. I can expect that already more than likely, but have you taken Evusheld? If so, did your team recommend it? Did you volunteer for it? I don't know. Just tell us a little bit about where you came to the conclusion of taking it or maybe not taking. Again, you keep it nice. I've got a delete button is right beside the one I can check mark you to accept you as a wonderful comment. I don't like doing that, but I also don't enjoy people being unkind. I don't expect that any of you will, but in case somebody jumps in that's a stranger to the community, not going to be the place for it. But feel free to comment and let me know what you think about this, what you've experienced. I would love to know that because we're working together as a community. We're growing together, and this is certainly one of the ways we can. So to answer that question, again, about Evusheld, hey, do your own research. Sit down with your team, discuss it, see if it's right for you. But be aware it may not be in the case of us as heart transplant recipients. Thanks so much for joining me. Until next time, stay stronger, friends.